You know, there's a condition that affects millions of men, but it's often kept in the dark, really shrouded in silence. So today, we're going to pull back the curtain on Peyronie's disease. It's a condition that doesn't just impact the body, it hits confidence, relationships, and mental health pretty hard. Let's get some real clarity on what it is and, more importantly, what can be done about it.
So this is often the question that starts the whole journey, right? It's an alarming symptom that can just show up, seemingly out of nowhere, and it causes a ton of confusion and distress. But it's not a mystery. There's a very specific medical reason behind it, and just understanding that is the first crucial step.
And you might be really surprised by how common this is. I mean, the official diagnoses are super low. We're talking under 1%. But research suggests the real number could be way, way higher, maybe affecting as many as 11 to 13% of men. That huge gap tells us that a lot of guys are just suffering in silence, maybe too embarrassed to get help, or maybe they just don't even know their condition has a name.
So what exactly is this condition? Let's break it down, get to the fundamentals.
Okay, so at its heart, Peyronie's disease, or PD for short, is basically a wound healing disorder. It's thought to be triggered by some kind of microtrauma. This leads to scar tissue, called a plaque, forming inside a layer of tissue called the tunica albuginea. The easiest way to think about it, imagine a small, really tough patch on a balloon. When you try to inflate it, that one part just won't stretch with the rest.
And that inelastic plaque, that's what causes all the different deformities. Curvature is the one everyone knows, but it can also cause shortening, a loss of girth, sometimes an hourglass shape, or even a hinging effect where the penis feels unstable. So it's a whole range of possible physical changes.
But the impact, wow, it goes so far beyond the physical. This research right here shows the incredible psychological toll. We're talking upwards of half of all patients experiencing depression and about 80% feeling serious distress. That tells you the hidden emotional cost is often way bigger than the visible physical one.
And that emotional weight is made even heavier by the fact that you can't just jump into treatment. You have to understand how the disease progresses, because honestly, it requires a lot of patience. It's really a waiting game, and it has two very distinct phases.
So those first 6 to 18 months, that's the acute phase. This is when inflammation is active, the curve can get worse, and there's often pain. After that, the disease enters the chronic phase. The pain and inflammation go away, and this is the most important part, the plaque and the curve stabilize. And that stability is the absolute key, because surgeons will only consider operating once the disease has been stable for at least 3 to 6 months.
Okay, so once the condition has finally stabilized, how does a surgeon figure out the right treatment? Well, it's not just guesswork. There's a really clear, logical roadmap that they follow to make that decision.
And this is the million-dollar question every patient has. The answer really boils down to a few key factors that a doctor is going to look at very, very carefully.
Now this flowchart, I know, it might look a little complex at first glance, but it's basically the step-by-step guide surgeons use. It's called a treatment algorithm. And it all kicks off with one single critical question that splits the decision into two totally different paths.
And here it is. This is the big one. Before anything else, the doctor has to know, setting the curve aside for a moment, is the patient's erectile function strong enough for intercourse? The answer to this question changes everything that comes next.
So now, let's actually walk through those two main surgical pathways that branch out from that one really important question.
All right, first up is Pathway 1. This is for the guys who have a stable curve, but who still have good, solid erectile function. For them, the whole goal is to straighten things out while making sure to preserve that function.
So inside this pathway, there are really two main strategies. For curves that are less severe, a doctor might do what's called a tunical shortening procedure. Just think of it like putting a few stitches on the long side opposite the curve to pull everything straight. The big plus is a lower risk of causing erectile dysfunction later on, but the trade-off is almost always some loss of length. Now, for more complicated or severe curves, there's tunical lengthening. Here, the surgeon actually cuts into the plaque and patches it with a graft to let that side stretch out. This can keep the length, which is great, but it does come with a higher risk of post-op ED.
And these images here really give you a clear look at what we're talking about. On the left, you can see a really severe curve. That's well over 60 degrees. And on the right, that's a shot from inside the operating room during a plication procedure. You can actually see the sutures being used to straighten the shaft.
Okay, so let's pivot to the second major pathway from that algorithm. This one is for men who are dealing with both Peyronie's disease and pre-existing erectile dysfunction that isn't helped by medications.
For these patients, an inflatable penile prosthesis is often considered the gold standard. I mean, it's basically a 2-for-1 solution. The implant itself provides the rigidity for an erection, and in a lot of cases, just inflating the device is enough to straighten the penis right out. If there's still a bit of a curve, the surgeon can do some extra steps, like molding, to fix it. It's a really comprehensive approach, and it's why the patient satisfaction rates are so consistently high.
But you know, the story doesn't just end with a rigid flowchart. The way the medical community thinks about this disease is changing. It's evolving. It's moving toward a much more nuanced, patient-focused point of view.
And this brings us to a really crucial point. While that algorithm is a fantastic guide, the modern approach is to look beyond just the chart. It's about taking a holistic view, where the final decision is less about the numbers on a page and much more about the individual patient's goals, their lifestyle, and their overall sense of well-being.
And this slide right here drives that new approach home. Research has actually found that a patient's level of bother, how much their pain and self-image are affecting them, is a much better predictor of their distress than the actual angle of the curve. It means a guy with a 30-degree curve could be suffering a lot more than someone with a 60-degree curve.
Which leaves us with this final, really important question. When it comes to treating Peyronie's disease, what's the real definition of success? Is it just about the geometry, getting a penis with less than a 20-degree curve? Or is it about restoring a man's confidence, his relationship, and his overall quality of life? It seems like the answer to that is becoming clearer and clearer every day.